Hello everyone. Welcome back to another session of Physio TV. Today we'll be talking about running injuries. So, running injury. Hello everyone. Welcome back to another session of Physio TV. Today we'll be talking about running injuries. So, there have been so many advancements in the running community that there is so many different running techniques, so many different running drills. Yet, the running injuries are still so prevalent in the community. So, we'll be talking about why it's happening. Well, first, to understand, the running injuries itself are multifactorial in nature. That means that it is not just one factor which is affecting it, but it is multiple factors. These factors may or may not be correlated to each other. So one factor might cause you an injury, then it might lead to another injury, or it might lead to triggering of the other factor. And these factors can overlap each other and cause further injuries. To understand the physiology behind the running injuries, we'll be explaining the load deformation principle. So, whenever a soft tissue is under a load, if this load is under the elastic region, which means that it will get deformed for some time, and then over time it will come back to its original alignment. So, if the stress is under elastic region, then it's fine. But the moment it crosses the microfailure zone and goes into the plastic region, it will deform permanently and cause an injury. So the abnormal amount of stress is falling on the body, the higher ground reaction force, because the running gait gives higher ground reaction force as compared to the normal walking gait, and the extrinsic and intrinsic muscle activity will cause you an injury. So these are some of the common injuries: the IT band friction syndrome, patellar tendinopathy, patellofemoral pain syndrome, medial tibial stress syndrome, plantar fasciitis, hamstring tendinopathy, ankle sprain, Achilles tendinopathy, and the stress fractures of the tibia and the metatarsal. If you look into most of these injuries, these occur because of overuse of the soft tissues. So as I've explained earlier, the load deformation principle, if you're stressing the soft tissue into the plastic region without giving it proper rest, it will go into permanent deformity and cause an injury. So the most common causes which happens is because of the altered biomechanics and the errors in the training of the runner, and some miscellaneous factors which we'll be seeing soon. So starting with the altered biomechanics, the foot posture first. So having an excessive pronation or excessive supination of the foot has been shown as a factor of running injury. Next is the foot strike patterns. So there are three types of foot strike patterns. One is when the posterior one third of the foot is coming in contact with the ground. Midfoot strike, where the middle one third of the foot is coming in contact with the ground, and the forefoot strike, where the anterior one third is coming in contact with the ground. So some studies have said that forefoot strike has higher incidence of injuries as compared to the heel strike and the midfoot strike. Next is the overstriding. So having a higher stride length has has been shown to cause a higher absorption of energy, but also causing transmission of higher loads, which will cause more of the injury. Next is the medial collapse of the knee. So an exaggerated femoral internal rotation and femoral adduction has been shown to cause the valgus of the knee, uh, which is also cause for the common knee injuries. And this is more commonly seen in the young female athletes. Next is the tibia angle. So The extended tibia, that means when the knee is completely extended, has shown to absorb higher loads as compared to the other ranges that you are seeing in right now, and they have been told to cause higher stresses and been another leading factor of injuries. Next is trunk lean. Having a higher trunk lean has actually been proclaimed by some runners that it is better than just running vertically. Contralateral pelvic drop. So an exaggerated amount of pelvic drop of the leg that is in the swing phase will is also has been a cause for the injuries around the hip joint. Other alterations in the biomechanics are the structural abnormalities like the limb length discrepancy, scoliosis, higher arch and lower arch, vertical displacement of center of mass, which means how much up and down you're bouncing, then higher foot inclination angle. If having a higher dorsiflexion while the heel strike phase, there have been more incidents of injuries and reduced knee flexion. Next is the asymmetrical pelvic movements like the excessive anterior tilt and excessive lateral tilt. Core muscle weakness, another important factor. Tightness of the hip flexors, rectus femoris, IT band, the hamstring and the hip adductor muscles, and the cadence. Next factor, we will coming to the training load. So having an increased running pace and increased mileage. So higher distance, setting a higher distance as a target, uh, running too fast too quickly without giving you enough rest periods, resting days. So these errors that the runners make are a leading factor of the injuries. Then running environment, running in the uphill region, downhill region without proper footwear before, without prior training, without a proper warm up can also cause the injuries. Not doing proper warm up and cool downs as well. Next is the miscellaneous factors. So gender as such, there have been conflicting evidence, but female athletes have been shown to having more of the knee injuries as compared to male athletes. And next is the BMI. Athletes with higher BMI have more incidence of injuries as compared to the lower BMI athletes. Then doing overtraining without a proper diet, with a poor diet, will also cause you injuries as there is lack of soft tissue healing and lack of adaptation of the soft tissues. Participating in the physical activities, high intensity physical activities, sports activities like swimming, cycling. So if you're not giving enough time for rest, then you will be more prone to the injuries. Next, another big factor is the footwear that you're using for running. You have to understand that the midsole of the foot, the shoe, is the most important part of the shoe as it will determine the amount of cushioning you are getting. So not understanding what type of shoe you have to use is a bad thing because you will be tending towards a higher risk of injury. So you can get more information of different types of footwear through this link down below. Next, where does us as a physiotherapist come into the play? So physiotherapists can do a clinical evaluation. How they do it? As you can see in this picture, they do a kinematic analysis in 2 dimensions or 3 dimensions. So what they do is they put sensors in different at different joints, as you can see in the picture, and then they'll take a recording of the athlete running on the treadmill, one in the anterior view, lateral view, and the posterior view. And then they'll do an analysis. They'll watch the video in different speeds, in the slow motion, the fast motion, and what they'll determine the biomechanical factors through that. Also, the physiotherapist has to check for the muscle weakness, the muscle tightness, what kind of shoes they're using, what kind of training they're doing, what kind of protocol is going on. Next is educating the patient that what kind of training they should do, how many rest days should there be, what kind of training should they start with as a part of the rehab. Then what kind of orthotics? So the runners should be prescribed with the appropriate orthotics, which is appropriate for the foot posture, for their arch. Then the sole should provide enough cushioning for the running style. And the therapist can customize the rehabilitation protocol for the athlete as to how many days they have to run, how many days they can do strength training, and maybe flexibility training as well. And then also the prevention, which is another important part. The physiotherapist should be able to train the patients or the athletes to prevent the chances of reoccurring of the injury or getting re-injured. So how they can do that is giving them appropriate warm-up exercises, appropriate cool-down exercises, suggesting them how to start like different, they make them run through different running surfaces. What is the safer running surface for them? What is they should not start with the harder running surface, should use the appropriate footwear, have proper cushioning of the footwear. So do all that. And there are different types of footwears that you can find on this link. There are different types of footwears for different foot postures. So you should get your analysis of your foot posture done by the physiotherapist and get prescribed with the proper footwear and any extra orthotics like medial high medial arch or raised lateral arch. Okay, so thank you everyone. That's all for today. I would like to thank Dr. Parag sir, Dr. Manisha ma'am, and Apoor sir and the technical team.